Hi, we would like to welcome you to the first of several modules in an introductory series to the post-COVID recovery clinics, which collectively make up the post-COVID interdisciplinary clinical care network of BC. Our goal through these sessions is to introduce you to the clinic, the network, what we know about COVID, and how you can help your recovery. First, a few housekeeping items before we get started. These education modules do not replace a visit with your doctor. If you are having concerns in your recovery following your illness with COVID-19, you should make an appointment with your family doctor. Second, what we've learned so far is that people need to go slow when returning to their usual activities following their COVID illness. While we know you're eager to digest all of the information we have to provide, we encourage you to take breaks in between modules, reduce your screen time, and rewatch the modules. Don't push yourself too hard. Third, not everything in these modules will apply to you. Take what is relevant and helpful, and leave what is not. We want to support as many people as we can with this educational content, and there is no single set of symptoms post-COVID, so some information may not be necessary for your unique combination of symptoms. And finally, let us know how we're doing. If you have questions or feedback, please direct it to post-covid-iccn@phsa.ca. So, let's get started with our first module. I had COVID-19 and I'm not back to my usual self. A quick overview of what we're going to cover in this session. We're going to talk about symptoms that linger after COVID-19 and how this might affect you. We'll also look at what supports are available to you. What we're learning is that anywhere from 2.5 to 10% of people who had COVID-19 may continue to experience symptoms for longer than 3 months after they first got sick. Although most people recover more quickly following a viral infection, lingering symptoms can be a part of recovery for some individuals. Some people are calling this long COVID, post-COVID fatigue, post-COVID syndrome, and we've heard about COVID long haulers. Whatever you choose to call it, it really refers to this long, persistent group of symptoms following COVID-19, typically lasting longer than 3 months. With increasing awareness of these bothersome group of symptoms, there has been lots of work across Canada, North America, and the globe to support the needs of patients who are experiencing these symptoms. The term we'll be using to describe this mix of symptoms is called post-acute sequelae of COVID-19, or PASC, PASC. So some of the more recent scientific research shows that 76% of patients discharged from hospital following COVID-19 had at least one persistent symptom at 6 months following their illness. And you can see here that there are a wide range of symptoms people experience, from fatigue to problem sleeping, pain, depression and anxiety, and difficulties with their sense of smell. Okay, so how does this impact me? For some people, the impacts of these persistent symptoms means that their life just doesn't look the same as it used to. People who were used to their schedule of an early morning with exercise, a full day of work or school, visiting with their friends and families, cooking their meals, can be challenging, if not impossible. Some people have a hard time returning to full-time work and school and doing all of the things that felt normal to them. So, the big question we hear from so many people, is this what the rest of my life is going to look like? Our answer? We are indeed hopeful that over time, with the right tools in your toolkit, you will improve. In fact, we are finding that people's symptoms do improve, but it does take time. We believe you, and we want you to know that you're not alone. There are many support groups out there and online resources that are connecting people just like you, sharing tips, tricks, and resources. We encourage you to use that community to help you on your road to recovery, if that works for you. Again, please speak with your doctor before trying anything new or starting a new exercise routine, etc. So, what can you do right now? You've made a great first step by listening to and watching this education series. Continue to work through the modules at a slow pace and make sure to take breaks. Review our online resources, and please complete our questionnaire at the beginning and throughout your time at the clinic to keep track of your symptoms. Remember, you're not alone. Many people experiencing these long, bothersome symptoms that are disrupting their normal life. But with the right tools, we are confident that you can get back to feeling more like your normal self. Thanks, and we'll see you in Module 2.